everyone. Welcome to episode 10 of Pesos and Paws, the Pet Health Podcast. I'm your host, Alex, and today we are digging into common cat diseases and what are the urgent, early signs and what really helps at home. And to help us more, get to know the answers to our questions, are our two doctors from the cat clinic. Welcome, Dr. Tree and Dr. Aijen.
Hi, thank you.
Hi. Hi, everyone. It's me again, Dr. Tree, and it's a pleasure to meet you again, Alex.
It's pleasure is mine.
Hi, I'm Doc Aishan from the Cat Clinic, Alabang and Green Hills branches. Thank you for having me.
Yeah. So glad to see you both again here for our 10th episode. So now we will dive into our first question. Oh, before anything else, a quick reminder to everyone, this show is for educational purposes and not a substitute for a hands-on medical or clinical exam for your pets. If you're concerned about your cats, make sure to visit your nearest veterinarian. So let's dive in sa ating first question. Are we okay? We feel fine? Again, you can answer in English and Tagalog, however you feel comfortable. Okay, so Dr. Tree, for cat parents who are new to pet care, what are the most common diseases you see and how do they show up early?
Okay, so for this cases, the number one thing that arise from a kitten, dito yung ating mga ongoing parasitic infestations. It could be the ear mites, kasi this one is kahit indoor yung pets mo, there is a chances to have it. So for this, we need to do an ear cleaning or ear swabbing or visit a vet to fully diagnose and what kind of ear drops ang needed. Second one is could be a gastrointestinal upsets, no? Kasi kapag bago tayo as a pet owners, we tend to feed a lot or mga pagkain na we wanted to try. You're saying ito commercially, so you wanted to pick it all. Sometimes it's too much, kaya nagkakaroon ng upset. Diba, Doc?
Tama naman. And then, what I also want to raise is mga dental issues. Ano? Very, very common yon. So, about age 3, 80% na ng mga pusa natin meron ng mga dental issues. So, very, very good to start them on early oral hygiene. So, that includes toothpaste, toothbrushing. Yeah. So, I mean, maski tayo naman as human beings, 300 years ago, hindi tayo nag-toothbrush eh. Ano? So, kailangan pala nila. And then doing that at home, plus doing every 12 months na professional cleaning. So, hand in hand yan. Magandang plan yan to keep them very healthy. Ano? So, mouth health yung simula ng overall health nila. Ganon. Other things din, yung mga skin issues. Maraming mga nakakahawa, mga skin parasites na pwedeng pumunta sa humans din. So, like fungal infections, ringworm, walang pinipili yun. Cats, dogs, humans. Skin parasites such as mga ticks, fleas, they can bite sa ating mga family members, lalo na kung may mga kids tayo sa bahay. So, yun.
So thank you. Nagulat ako dun sa kasi all of that as a cat parent, actually I also experienced that with my cats and hindi siya ma-avoid. Like ever since I was a kid, we had a cat na ganyan and then we encountered this and then ngayon na lang actually nagkaroon ng open discussion about this and I'm really really glad that you guys are here to help our listeners and watchers. And question to Dr. Aijen, what are those quiet little changes at home that should make us pause? Like appetite, hydration, or little habits? Yung
Okay.
changes.
Sige. Kasi cats, they are creatures of habit. Gumagawa yun ng sarili ng schedule. And then once they make that, they stick to it. So, when you notice that cat, okay, is this kind of cat yung nanggigising sa atin? So, umaga, is it asking for breakfast? Meron yung routine, midday, and then tanghali matutulog. So, as a pet owner, you would notice what it does at a specific time of day. So, any deviation outside of that, you might want to think about anong nagkukos nito? May bisita ba ako kaya siya nagtatago? Meron bang noise like may gumagawa ng bahay sa kapitbahay? Are those external factors influencing yung behavior ng pusa, 'di ba? And then when you look at yung food intake ng cat, you would notice if that kind of cat yung tipong pag binigay mo yung food, uubusin na ba nila? Or other kind of cats na tikim-tikim pero maghapon kakain sila. At the end of the day, same pa rin yung intake. So when you know your cat, you would know yung what makes that cat a cat, ganun. And any little difference that you would notice, halimbawa, usually kakain siya ng ganito karami at this time. That's one thing that you would notice. Sometimes that's really the first thing. Hindi na siya kumain bigla. Ano, other times, specific time of day na naglalaro itong pusang 'to, biglang tulog lang pala siya ng tulog. So that can be yung early signs na, okay, nananamlay na pala sila, gano'n. And then outside of that, it's good to check your cat din, kakapain mo, if there's anything off. So especially with cats na owners that have long-haired cats, so may mga times na may mga sugat, 'pag tinitingnan namin sa clinic, 'di ba minsan may sugat na pala, oo, gano'n. So very good to really check your cat from head to tail, oo, gano'n.
I see. So observation is very important. So have to be very hands-on as a cat parent. Buti na lang hands-on ako. Very proud. And also to our listeners who are cat parents also, make sure to check on your cats. If sa tingin nyo they're doing something unusual, tama ba, they should go to their nearest.
Yeah.
And I think naman if there's nothing wrong, well, it's better. So do you encounter those types of situations as well?
Yeah, mostly kasi na ng mga cat owners, they call it crazy cat owners. Yeah, tayo mga cat owners, kasi most of us, kasi talaga even the changes of the litter boxes na pinunta mo lang sa ibang side, di na siya nag-urinate, those things could be a sign of UTI or constipations. So we need to physically bring them on the clinic or try to observe it first for the first 24 hour, kung may output ba, things like that. Kasi if you're not observant with your own cat, para siyang hindi sa'yo. Gano'n, diba?
Parang personal relationship.
Yeah.
And yeah, I think yun then very important that you pay attention, yes, to what's happening. Okay, thank you for that.
Alright.
Okay, so the headline is small shifts, big clues, energy, eating, drinking, grooming, and litter patterns often speak first. So watch your cat closely. Okay, let's move on to respiratory infection. So Dr. Aishan, respiratory infections feel common. What signs should pet parents should watch out for?
Well, it's very common talaga, like worldwide. May mga cats na they acquire infections even if they are indoor. So very important talaga yung vaccinations. Then sa mga symptoms, they typically present as how we would see it in a human, bumabahing, teary eyes, namamaga yung mga mata, ganun. And some of the things that affect yung eyes and nose, they will affect eventually yung behavior ng cat. So when yung plema super kapal, mawawalan sila ng panghinga, hihina yung gana sa pagkain. So typically for any symptom that you observe that's new, lalo na hindi naman to ganito, biglang sinisipon na, let's say, better to have a scheduled checkup. The day after you find it, pwedeng ganun. Kinabukasan, papacheck up mo na kagad.
It's better to be crazy kasi you have to be parang, ano ba yun sa Tagalog? Sigurista ka. Tama. Okay, so let's move on to the next question about kidney disease. Kidney disease comes up a lot, especially with senior cats. So why are cats prone to it, and how does it typically manage? How do pet parents manage it in the long term?
Okay. So, case-to-case basis, no? So, usually, ang mga chronic kidney injury or failure happens eventually sa mga common senior cats. But before it develops, it shows signs na. So, that's why it's very important for you to visit vets quarterly to perform some blood chemistry panels. Talagang di sila nagpapakita ng symptoms, not unless sobrang lala na. So, better to prevent than having an issues na. Talagang bagsak na ang katawan, wala na tayong, hindi na kumakain yung pusa because of the ongoing periodontal problems na very common din. So, these chronic kidney diseases are eventually developing, number one, because of the food intake or yung mga diets available commercially. If it's too much protein, too much salt, it could cause issues. And some of it are genetically induced problem. Yeah, breed predilected, no? So even Siamese Persians, most of them, even though you're giving the whole best treatment, diba?
I too have a cousin. She has like siguro 10 cats. She started with 10 cats. She loved them very much, but like even though she buys the high-end foods, yeah, may problem talaga eh. Nagkakaroon ng kidney problem. So we should watch out for that and make sure even our senior cats, young cats, will have a visit with their vet. Tama.
Yes.
Those are things kasi na they come with age, not necessarily yung edad, pero as they age, nagkakaroon ng mga wear and tear. So very good talaga yung regular na visits. And even if like in the best, like yung example mo, alagang-alaga, they can still develop diseases.
So parang kahit these cats are kept inside a beautiful home, with like spoiled with delicious, like let's say high-end foods. Yeah, it happens. It happens to every pet owners and every pet out there. So, to our listeners, please watch your cats closely. Okay, another is, what are the early signs families can spot at home? And at a high level, what does ongoing care usually look like?
For this naman, ang mga chronic kidney injury in cats, they tend to not eat, not drink or anything, not moving. So if you observe those things, especially if it's a senior one, better visit for emergency na. Kasi if the cat is not moving at all, it could be an ongoing hypothermia or yung bagsak ng body temperature, kasi physiologically it does a lot of problem. Pag ang kidney nasira, it follows. So multiple organ failure may occur. So better talaga you should watch it. Or at least if your cat is already a senior one, prepare for, at least have a budget for it. Kasi as an owner, you should know that na every at least quarterly, take a visit, prepare for the blood chemistry. Kasi we vets, we physically assess, or we only base on the symptoms that we gathered from you. But it is also a different side if we saw the blood chemistry panel, the complete blood counts, that will help us to fully diagnose the cat.
Yeah. To build sa point ni Doc Tree, very important talaga yung regular na visits natin. Kung mga bata pa yung cats like 7 and under annual, okay na okay pa yun. Oo. Kasi there are times, lalo na sa kidney disease, minsan when you diagnose or magpakita na ng issue yung pusa, advanced stage na siya. Rarely lang nasa stage 1 or stage 2 sila. Kadalasan, okay, stage 3 na pala to, we haven't known. Ganon. And so, doing yung regular na assessments, okay, blood pressure, mataas ba? Kasi medyo intermingled din yun, hand in hand. Majority ng kidney patients, hypertensive din. Usually, first sign, mas uhawin, mas marami yung wiwi, ganun. Pwedeng ganun. Gradual na weight loss, parang, hindi lang, pumayat to, hindi lang ba nagbago yung food or what? So, for the chronic kind, onset talaga mas matanda. I see usually 7, 10,
Okay.
ganon.
And wala naman yung parang, let's say, mild symptoms at the early age of what? Yung cats.
Okay, so for mild symptoms, things could be nystagmus or yung meron na twitching on the eyes. Sometimes meron din tayo mga cases na asymptomatically, wala siyang symptoms behaviorally, but if you're going to visit the vet just for just full checkup, then you could see it. Kasi as I said before, some of the breeds had this issue genetically na. So they could develop a polycystic kidneys na asymptomatically doesn't show pa as long as the kidney is working well. Pero if the time goes by, if you're still feeding a lot of potassium or a lot of protein to your cat, it will deteriorate. Yes.
And then dun sa mga cats din na, medyo sakitin, on and off sa clinic, a lifetime of medication din, pwede din mag-take ng damage yun long term.
And yan yung mga bagay na hindi naririnig usually ng ating mga fur parents, because syempre they know they've been taking care of their cats. Hindi ko na kailangan magpa-vet, but you don't know what they're feeling.
Even we don't know, So like kapag nakita natin, let's say sa tests or nagmanifest yung symptom, yeah.
Marathon is not a sprint. So you have to have diet, hydration, and regular checkups to keep up ahead of problems. So Dr. Aishan, question for you. When is it okay to monitor for a day or two? And when is it okay to see a vet today? Yeah.
So the question is like, ano yung urgent? What's an emergency? What's not? So in general to, like any kind of like condition, ganon. Sige. So usually stuff like anything with the eyes, bleeding eyes, a popped eye, ganyan, broken bones, pilay, halimbawa, there's a limp, especially if we suspect may fracture to, ganon. Stuff like hindi nakakawiwi, yan. Urgent yung mga yon, you have to go within the day. Emergencies sila. Seizures are also considered emergencies. Going back to something more common, you would notice blood in the stool, blood sa vomit, That's a thing na we'd like to see soon din. Ano, kung diarrhea kasi pwedeng hintayin mo pa, maybe give it a day or two, benefit of the doubt lang. Pero yung profuse nonstop talaga, okay, kailangan mo nang pumunta whether or not may dugo yun. Ano, what else? Kung yung cat mo biglang nawawalan ng malay, because a normal cat, whether with exercise or not, biglang nawawalan ng malay, nagko-collapse. Okay, you have to go. Is that heart disease or may neurological disorder sila? Those are stuff na cannot wait. Tapos, in general, a rule I go by, whether for my cat or advice to clients is, if the cat can still pumunta sa kainan, to eat, to drink, can urinate, may lumalabas. Hindi yung nakapwesto na sa litter box, okay na. We want to see, pag umiihi sila, lalo na if we suspect may urinary issue sila, titingnan natin yung flow ng miwi. Oo. And if you're noticing those normal behaviors, nakakapupo also, then it should be okay. You can wait until, okay, lumala pa ba to? Or is it something na hindi talaga siya nag-i-improve, pero hindi naman siya like actively dying? It's better to get yung professional opinion talaga. When in doubt, go for a vet checkup.
Yes, that's very important. Okay, let's move on to another question for Dr. Ajan. A lot of owners worry about feline leukemia virus and FIV. How do these affect cats day to day, and can they be prevented?
Yeah. So very common, si FIV and FeLV. So two different viruses yon. They're related to HIV in humans, diba, docs? So the main transmission nito actually is between cats, and the mode of transmission is actually usually through bites and body fluid exchange. So stuff like transfusions, we almost never have those cases. Blood transfusion na FIV infection or FELV. Pero for the most part, yung kagat. So let's say you have a cat nakalabas ng bahay, nakipag-away with other cats, that can facilitate you. Kung carrier yung other cat na yon, they may transmit. Ito yung big three na tinitingnan ko. So whenever I have patients, just in the last week I had 3 na nakipag-away, lumabas. Big 3 na titingnan ko, rabies. So rabies is endemic in the Philippines. We're trying to eradicate this pa. FIV and FeLV. So those are things that we want to check na coming from an exposure to whether or not pusa yung kaaway niya. Kung aso, edi wala namang FIV or FeLV yung pwedeng ma-transmit. Best way to prevent them is to keep them indoors. So minimal access talaga sa away. For the male cats, you want to neuter them. That will help to reduce yung roaming behaviors nila. Gusto nila maghanap ng girlfriend. Diba? So, yun. Tapos, for the most part, FELV, it's kind of starting to become available. That's a core vaccine na as of 2024. So, recommended kailangan na siya. Parang kailangan din nila ng rabies vaccine. FELV is good. Some clinics will carry that depending on yung volume nung clients, bale. Tapos, FIV, unfortunately, I believe wala pa tayong vaccines currently. For both of them, walang treatment eh. So, prevention talaga yung mas gusto natin. The issue kasi si FeLV, it causes bone marrow changes. In the name, it's feline leukemia virus. It is a virus that can cause cancer. Ganon. Si FIV naman, para siyang HIV talaga ng pusa. End stage niya, it causes a condition very similar to AIDS in cats na wala na silang immune system. So, any kind, like sipon or diarrhea na super mild, pwede na nilang ikamatay. Ganon. The good news naman, it takes a long time before those signs manifest. And if the cat is older, bago sila makuha, typically hindi na to nag-overlap na. They get sick from it. So there's a big overlap where the cat can have or carry the virus pero hindi sila sick or ill from it. Pero better pa rin to not have yung exposures.
So that is a good warning also for most of our clients din kasi are rescuers, no, ng mga strays. So the number one thing that we need to conduct is to test your cat if it's positive from those kind of viruses, leukemia and FIV, kasi we can't eradicate or we can't sabihin natin na magne-negative siya because it's a lifetime disease present in your immune system. So, to prevent those things, number 1, neutering lang talaga. So, para lang din hindi na kumalat from the mother or father of the cat also, and the vaccination. But unfortunately, before we proceed with the vaccines, it needs to be tested na negative sila. Kasi it could trigger more kung positive yung cat with this kind of viruses.
Okay, so another follow-up question for you. Dr. G, when should a cat be tested and what lifestyle choices in their living, careful introductions really lower risk?
Okay. So for this, once you had the cat, especially if this is a stray cat, yeah, we can do we have a kitten executive package here at the cat clinic wherein we conduct the laboratory testings for the common viruses that could have sa outside world. Outside world. Kasi- and then once tested and then at least complete the core vaccine first. After the anti-rabies, we can do the feline leukemia virus vaccine. Mm-mm. And also, if you have another cat sa bahay na imimix with the new one, make at least 21 day of separation kasi by this time, the cat could have a manifestation of the viruses kung meron man siyang na-acquire outside.
Yun, very important yung quarantine period. So, kahit any animal, may dogs ka, you're getting a new cat, or vice versa, ganon. Maganda.
At least we know what not to do. Kasi honestly, in our family, my lola loves rescuing cats and like giving them a new home to friends and family. Pero like, pag nahahalo sila sa cats namin at home, yun ko lang narinig eh. Pero so thank you, Doc. Pag nahahalo siya dun sa mga cats namin, nagkakaroon ng sakit, yung pets namin. So that's very important pala. So to our watchers and to our listeners, quarantine period is very important. Tama ba?
Yes.
All right, so that is get to know your cat status, limit exposure, and plan care, especially in multi-cat homes or when adopting. Tama. Okay. So let's move on to practical longevity tips. Longevity tips. Okay. So this is for the both of you. Okay, let's get practical. What are your top tips to keep cats healthier for longer and avoid these common diseases?
Okay, sige po. For these cases, the number one thing is do vaccinate. Kahit anong taon, ilang taon mo siya na-rescue, do this annually. Visit the vet quarterly. Number two, the reason for this, there is a lot of diseases that cannot be manifested agad. So this laboratory may help for us to fully diagnose, give the necessary medications before it's too late. Mm-mm. Ayun. And then lastly is I do recommend also to neuter or dual castration and spay to prevent it from developing mammary tumors or testicular cancers. Yeah.
Ang dami na nasabi ni Doc. Naubusan na ako ng sagot. Oo. Pero yeah, very good points, no? Vaccinate, regular checkups, yeah, neuter spay. We're all advocates of that. Para sa akin, I mentioned it earlier, oral hygiene is very important. So doing that will help to provide your cat a straight pathway or unobstructed pathway to getting double digits in years, if ever, that 15 to 20. Ano, number two, obesity is a very, very big problem. Ano, if the cat is too fat for too long, pwede sila magka-diabetes, ano, blood pressure issues, hormonal issues, thyroid problems, mga ganon. Ano, and I cannot stress enough yung importance ng regular na visits talaga. Kasi a lot of the times, hindi natin alam mukhang healthy yung pusa. Uy, nagsa-start na siya mag-manifest ng ganitong issue. Ganyan. Usually, it's organ issues. There can be such a thing as too much kasi parang, okay, we're loving our cat too much, mapapakain natin too much, mabibigyan natin too much ng vitamins, ganyan. Ano, so parang good to strike a balance, and that thing you can consult with your vet for your specific cat kung ano yung need talaga nila.
That's amazing. For sure. Alam nyo, if ever, I just wish na I watch this before I adopted cat. Kasi right now, he's older and we've encountered a lot of problems back then. He's ano na, five to six. Actually, yun nga eh, yung parang the thing that we went through, parang sobrang dami. That parang made him weaker and weaker. And maraming trial and error. Kasi I too don't have knowledge like this. So, question to Dr. Tree. Give us one first year tip for kittens or young cats. First year. Yeah, yung first year of life. Like, what are your tips sa mga first pet owners, and then parang yung they have like a kitten. So what's your kit?
Yeah, for this, we follow the wellness package at the cat clinic. We do the worming first 4 weeks, no? We do the worm na kahit super liit pa nila. Kasi this kittens could carry parasitic inside. So, it could manifest na malnutrition, anemia, sooner or later pa siya magkaroon ng problem. But for us to prevent those issues, deworming may help to eliminate. After our deworming, vaccination, the core vaccine, the herpes, calisi, parvo, which is very common to cats, and the chlamydia respiratory problems, no? So, this may help to encourage a high quality life pa niya sooner para hindi rin tayo mag-develop ng any other common diseases ba na kaya naman nating ma-prevent.
Okay, so sa first year, let's recap it. Vaccines and deworming. Okay, very important. And to Dr. Aisha naman, one senior cat tip that really moves the needle for you.
Okay. So para sa akin, again, making sure that they're at a healthy weight. Ang dami kong patients, they're all overweight. Majority.
Kasi parang mataba yung cat and then parang kapag pala pumunta ka na sa vet, it's just not good.
Very important to really practice that. Kasi the lifespan naman nila maiksi eh. So yung small, short-term na changes natin, sige, bigyan na natin ng extra cat food. It mounts a lot. Malaki yung impact nila. Ganun. So, and as I mentioned, weight management. And then you can ask your vet for screening specific issues. Lalo na pagdating sa old age nila. Anong blood pressure ng pusa ko? Check natin yung x-ray. Malaki ba yung puso niya? Ganun. And then, is there a mobility issue? Check mo yung mga kuko. Ganun. And regular na depending on what they need. Kasi may mga times na cats, they develop issues that require them, halimbawa, to extract teeth. Ganun, namamaga ba yung ngipin? Are their appetites okay? Is it still fine? Ganun. And when it comes to older age kasi, kilala mo na yung pusa mo, they're not really going to change their behavior. So it's actually kind of easy to maintain them. Pero seeing that they want to maintain yung same na ugali nila for so long, it's easy for them kasi to really mask yung yung kanilang issues or symptoms. So going back to yung ating main issues, it's really about making sure that you want to have your vet checked up regularly, and more so kapag matanda na sila. I mentioned earlier, there's a lot of age-related na mga issues. Some of them are degenerative, ibig sabihin lumalala lang. Some of them are also progressive. As time goes by, tuloy-tuloy lang. Ganon. And the age itself is not a disease, pero it comes with age that they do tend to develop these issues. And pinaka-common, isa sa pinaka-common nakikita natin, mga kidney diseases, very, very, very talamak.
All right. Okay, thank you for that, Dr. Aishan. For the both of you, question lang yung range when it comes to the cost of these diseases. Kapag iti-treat na siya, syempre, we as cat parents, we pay for it. And then, kapag dito sa mga common cat diseases, how much is it? How much will it cost us pet parents?
Okay, so first and foremost, we need to diagnose first your cat. So we're going to conduct some laboratory testings. So in the cat clinic, we have a specified testings, just like the kitten executive checkups. It range around 15 to 18,000, which includes the complete blood count, everything that it needs to fully diagnose. And in terms of adult one, we have adult executive checkups that includes the diagnosis if there is any ongoing cardiopulmonary diseases, kidney diseases, liver diseases. It covers around 15 to 18,000. So for the laboratories. And for the medications, I think it will roughly around 5,000 to 10,000 could be the maximum. For the medications, around 21 days. Necessarily if meron pating ongoing symptoms.
And then that also depends, yun nga, yung first point ni Doc Tree, kung ano yung diagnosis ng patient. Kasi, is it yung disease ng cat natin, is it a one and done? Nagkasakit, mapapagaling? Or is it nagkasakit, tuloy-tuloy na? And in those cases, mas mahaba yung horizon mo. Mas, we can expect mas marami magiging gastos nila. And it's very good to have this kind of conversation. Kasi mas, we can bring it to light na pets are our responsibility talaga, na worth it nating gastusan pagdating sa whenever they present with some illnesses. Ano. So, when it comes to, let's say, a chronic issue, be prepared for 5 digits, can be 10, 20, even 30, depending on how long yung kaya pang ilaban ng ating pet. Ano, especially for cases na terminal yung sakit, ano, and cancers are common, ano, liver, kidneys, may mga ganun na wala, permanent na. Wala nang cure. Oo, gano'n. And yung medication that you're going to be maintaining, usually they're just to slow down yung progress or, just to keep the cat comfortable, alive. And then there are some diseases naman na surgical yung treatments. And then for surgeries, hindi sila nagbababa ng sometimes 7, 10, 15. And then depending on what specific kind of surgery, there can even be surgeries that go upwards of 20,000 din.
As in talagang to the highest level yung prices ng ating mga procedures. And for those what if standard insurance, pet health can help with these illnesses, diseases. If you have any questions, don't hesitate to message us because policy and take note that policy term may apply. So families can focus on care, not just cost.
Kasi hindi ano, may mga hindi expected talaga, eh. You can do everything right, magkakasakit talaga.
It's all part of having a cat, a fur pet, a pet at home. So parang ano na rin yan, it's part of your family. So parang it's like a brother, a sister, a kid, 'di ba? Lalo na ngayon, mas dumadami ang Gen Z, millennials and Gen Zs who are adopting cats. So we work for our cats. Okay, so common cat diseases start subtle. So noticing the changes really makes a big difference. Again, Dr. Tri and Dr. Aijan, thank you so much for joining me today. It's such a pleasure. To our listeners, share your stories on our socials. If you want to learn more about Standard Insurance Pet Health, you can visit our website, www.standard-insurance.com, or go to our Facebook page, Standard Insurance Pet Health. Join us next time on Pesos and Paws. Stay informed and keep those tails wagging. Bye!